This is the Emergency Medical Minute.
So this one has multiple points of interest today. So you'll find this very enjoyable. So this is an ancient finding in a Bolivian cave, these little morsels. One is a pipe and one is like a little holder for paraphernalia. You can pass these around. And this one is like I think it's like some sort of a skunk head or moose head or rat, something that holds drug paraphernalia. And what they did is they did microscopic analysis and they did like gas spectrography and found that 1,000 years ago, there was people that were carrying around these pipes with what is essentially cocaine and DMT. So it's not a new problem today in the ER. It's been going on a little while longer. And I venture to predict it will be going on for another 1,000 years, knowing our patient population and the nature of humanity. So the interesting thing here is they thought it was probably from some sort of shaman or medical healer. And the tie-in is today is election day in Denver, and they're voting to have magic mushrooms on your person, which is psilocybin, another hallucinogen. And so there's sort of some relation with the DMT found in this little moose satchel or whatever it is, and the psilocybin. And then that brings me to yet another topic that ties this all together, treatment with psychedelic drugs, ayahuasca, and I'm sure I'm saying that incorrectly. This is a drink. It's kind of this murky brown water that they were doing in Bolivian tribes. Basically, you drink it, then you vomit violently, and then you have a crazy hallucinogenic trip. Ayahuasca? Yeah. Ayahuasca? Okay, there's the pronunciation from our ayahuasca expert. So all of this ties in because there is some data that if you send someone on an ayahuasca trip and they have severe depression, not treatable by pharmacologic things like our drug companies do, the SSRIs, if you do it like the first day and you say you're still depressed, there's no difference in that versus placebo. But if you go like 2 or 3 weeks out, there is a significant improvement in people who go on a hallucinogenic trip being happier 2 weeks after this purging and hallucinogenic effect. So does that mean those of us who live in Denver should vote to legalize the psilocybin magic mushrooms to decrease our depression so people won't be using cocaine and coming into our emergency department? Maybe. I'm not endorsing it. That's our medical minute.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.